All right, let's talk about something we all take for granted. We tend to think of medicine as a pretty straightforward science, right? You get sick, you take a pill, you get better. Simple. But what if I told you the way we use medicine is actually causing a massive and mostly invisible problem? Today, we're going to unpack a global health issue that, believe it or not, affects pretty much everyone: the irrational use of medicine. Just look at this number for a second. According to the World Health Organization, more than half of all medicines worldwide are used improperly. That is a staggering figure. It means for every 2 prescriptions written or pills you see, one of them is likely wrong or unnecessary or even unsafe. That number really sets the stage for everything we're about to get into.
So what do we actually mean when we say irrational use? Well, it's basically when the medicine a patient gets just doesn't match up with what they truly need. It could be the wrong drug entirely, or the wrong dose, for the wrong reason, or maybe for the wrong amount of time. The key takeaway here is that it's not just ineffective, it can be actively harmful.
Okay, now that we've got the definition down, let's look at how this problem actually shows up in the real world. Because it's not just one thing, it's a whole collection of common and often pretty dangerous habits.
First up, we've got something called polypharmacy. This is when a patient is juggling a whole handful of different medications, often 5 or more, that just aren't all clinically needed. I want you to think of it like a chemical traffic jam happening inside your body. The more drugs you add to the mix, the higher the risk of some really dangerous interactions and side effects.
Now here's one I bet we've all encountered: antibiotic misuse. We feel absolutely awful with a cold, we drag ourselves to the doctor, and we just want a quick fix. But here's the thing: antibiotics only work on bacteria. They do literally nothing against viruses like the common cold. Taking them when you don't need them, or, just as bad, not finishing the full course when you do need them, is a huge piece of this puzzle.
Another really common issue is the overuse of injections. Sometimes a shot just feels more powerful or like it's going to act faster, right? But if a simple pill or a syrup works just as well and is safer, an injection just adds unnecessary risk. We're talking about pain, sure, but also, more seriously, the potential for infection. And finally, there's inappropriate self-medication. This is a big one. It's when people take powerful, prescription-only drugs without getting a proper diagnosis from a healthcare professional. Using leftover antibiotics from a family member or buying something strong over the counter. It's basically like flying blind, and it can have some really serious consequences.
So if this is all so risky, why on earth is it happening on such a massive scale? Well, the answer isn't simple. It's this complex web of different factors. And it's really not about blaming any one person or group, but about understanding a system that's kind of broken.
What's really interesting here is how the responsibility is spread out. On one side, you have things like patient pressure, that I need a pill for every ill mindset. Doctors are also dealing with diagnostic uncertainty. Sometimes they prescribe something just to be safe. But then, on the other side, you've got these huge systemic issues: aggressive marketing from drug companies, poor communication about how to take meds, and in some parts of the world, completely unregulated markets. It's really a perfect storm. We've seen what this problem is and why it happens. Now we get to the most critical part of this whole story: the consequences. The cost of all this irrational use isn't just measured in money, it's measured in human health and safety.
So let's just ask the question directly. Why is getting this so wrong so incredibly dangerous? The answer really unfolds across 3 major areas of impact.
The consequences really create this kind of threefold crisis. First, there's direct harm to patients. Second, there's a massive economic burden on our healthcare systems. And third, and this is the big one, there's a threat that puts the entire future of modern medicine at risk: antimicrobial resistance.
For you, as an individual patient, the dangers are immediate. The wrong drug or the wrong dose can lead to severe side effects or even make an illness drag on longer. And when treatments fail or cause harm, it starts to wear away at the most important thing in medicine: the trust between a patient and their doctor. But the ultimate threat, the one that keeps scientists up at night, is antimicrobial resistance, or AMR. See, every time we misuse an antibiotic, we give bacteria a chance to evolve, to learn how to defeat our drugs. This is what creates superbugs, nasty infections that our best medicines can no longer treat, turning things like a minor cut into a life-threatening event.
And hey, don't just take my word for it. The World Health Organization itself calls AMR one of the most significant global health threats today. When the world's leading health authority uses language that strong, we absolutely have to sit up and pay attention.
So the bottom line is that this isn't some distant, abstract problem for scientists to solve. It's a challenge that involves doctors, pharmacists, policymakers, and most importantly, us, the patients. Our health, and really the future of medicine itself, depends on all of us getting this right.
And that leaves us with a final, really vital question to think about. This isn't just about what doctors or regulators should do, it's about what we can all do. How can we, in our own lives, become better stewards of these incredibly powerful tools? It comes down to asking questions, carefully following instructions, and understanding that sometimes the best medicine is no medicine at all.